Hello friends, today we will see one important topic, one important test that is called FeNO, that is fractional exhaled nitric oxide. This test is important for bronchial asthma, and this topic is important for your clinical purpose as well as for your exam purpose. Frequently questions are being asked in your DM entrance examination or NEET super specialty and DM final year exam. So let's see FeNO. So before going inside, we will see one case, and by this case, we will have idea where to do FeNO. So this is hypothetical case, not real case. This is 30-year-old female who has typical symptom of asthma like wheeze, cough, chest tightness, everything for 4 years, which was chronic, non-episodic. And despite of having these symptoms, she was not taking any inhaler or any specific treatment for asthma. Whenever she had symptoms, she used to take SOS, salbutamol, and sometimes montelukast. And because of that, she was fine. And she came to our OPD. We did X-ray that was normal. And the challenge thing is that spirometry is also normal. So diagnosis is very difficult in such type of patient. So we gave diagnosis of adult onset asthma. Now question to you, what will you do for diagnosis? Because this is challenging patient. Patient has symptom of asthma, but spirometry is normal. Then how to diagnose? So one traditional test is there, that is bronchial challenge test. It is being used in past by using methacholine inhalation, and we have to see bronchoconstriction, the amount of methacholine by which there is reduction bronchoconstriction by 20%. That is bronchial challenge test. But this is some risky test, not oftenly used in clinical setting. Okay, so any other test by which we can find out what is happening in this lady? So with this clinical background, we will see our next slides. So asthma endotypes. So many times you must have heard that there are many different phenotype of asthma, many endotype of asthma. So we will discuss about endotypes. So what is endotype? Endotype is the underlying biological mechanism of asthma. How asthma is developing, biologicals, inflammatory pathway. So depend on inflammatory pathway, there are two types of asthma. There's two endotypes. What are they? They are type 2 inflammation, that is T2 high asthma, and non T2 or T2 low asthma. So there are two endotypes. So we'll discuss detail what is two endotypes. So T2 high asthma, this is by type 2 inflammation. T2 means type 2 inflammation. And this type of inflammation, there is role of interleukin 4, 5, and 13. So whenever you found this type of leukin 4, 5, and 13, you will have an idea whether patient is having type 2 inflammation. And this inflammation is due to eosinophilic inflammation, due to eosinophil cells. So whenever there is high eosinophil in the body, they will produce IL-4, 5, and 13. And whenever there is high eosinophils, they are much responsive to corticosteroid. Once you will give corticosteroid, the eosinophil count will reduce drastically and patient will improve. Also improve with biologicals, specific biologicals. There are two types: allergic driven asthma, which is usually there since childhood, also called IgE mediated. You must have heard mast cell IgE. So this is allergic asthma. Eosinophilic asthma, but what we are discussing about is adult onset, often severe asthma. So same inflammation is there in our patient. Another endotype is non-type 2 or T2 low asthma. This is not eosinophilic, this is neutrophilic driven or polygonocytic inflammation. What are the cytokines involved in this type of asthma is 17, 8, and TNF alpha. So different mechanism, different inflammation. That's why this is different endotype. Since there is no role of eosinophils, so less responsive to corticosteroid. Two types: neutrophilic asthma and polygonocytic asthma. There is minimal inflammation. Neutrophilic asthma is common in infections, pollutions, obesity, smoking. Okay. So if you see prevalence of this endotype, you can see 84% of patient of asthma, they used to have type 2 inflammation. And whenever there is type 2 inflammation, there will be high eosinophil count in their sputum or high FeNO. FeNO we will see in further slides. And eosinophilic so is very responsive to corticosteroid and prone to exacerbation. While minority of patient, around 15 to 16% patient, they are having non-type 2 inflammation and they are poor respond to corticosteroid and they are usually obese, smokers and old age. So in short, what is type 2 high asthma is eosinophilic, allergic, steroid responsive. T2 low, neutrophilic or possible nocytic, steroid resistant. Okay. So when I say this asthma is due to eosinophil, there must be eosinophil in airway. Okay. So how to detect eosinophil in airway? There are three methods. Either you see eosinophils in sputum. This is a very cumbersome test, and many laboratories they are not doing this test. Okay. Another option is you do bronchoscopy and demonstrate eosinophil in bulb fluid, but this is again an invasive test. Okay. So another test is FeNO, axial nitric oxide. This is non-invasive test, easy test, non-invasive test. We will see further. So this is having correlation with sputum eosinophilia. Okay. So this three test we can do to find out eosinophilic type of asthma. Now let's see nitric oxide. So nitric oxide, you must have heard this is gas. Okay. And nitric oxide is there in our body. Normal individual, they are having traces of nitric oxide. Okay. So how this nitric oxide is being formed in our body? In our body, there is amino acid called L-arginine. Okay, normally it is there. And one enzyme called nitric oxide synthase, NOS, nitric oxide synthase. So this enzyme act on L-arginine and produces nitric oxide. So this is how the nitric oxide produces from L-arginine because of this enzyme, nitric oxide synthase. This is three type: neural nitric oxide synthase, inducible, endothelial, NNOS, INOS. And because of these enzymes, nitric oxide is getting formed in our body. So in normal individual, little amount of nitric oxide is there, which is beneficial. What is beneficial? This is vasodilator, so reduces your blood pressure. Bronchodilator, neurotransmitter, and inflammatory mediator. It has free radical properties, but it is beneficial. How? It is highly bactericidal and cytotoxic. So little amount of nitric oxide is beneficial. But what happens if this nitric oxide level increases in the body? Okay, how it is getting increased? Because of inflammation. In asthma, what happens? There is biology of asthma, there is inflammatory cytokines, everything is there. These inflammatory cytokines, which one? 4, 5, 13. These inflammatory markers, these inflammatory cytokines increases nitric oxide synthase, inducible one. Okay. And because of increased nitric oxide synthase, there is more production of nitric oxide from L-arginine. Okay. So this excess amount of nitric oxide is there in asthma patient who are having eosinophilic type of asthma. That is type 2 inflammatory asthma. And this excess nitric oxide is harmful. Okay, everything is in excess is harmful. Likewise, excess nitric oxide is harmful for our body. How it is harmful? This causing bronchial hyperreactivity, bronchoconstriction, mucus hypersecretion, increased vascular permeability, and various pro-inflammatory effects including free radical production which lead to cytotoxicity. Okay, so this is harmful. So this excess of nitric oxide is harmful and it produces with the help of cytokines due to eosinophilic asthma. The normal it is less than 25 parts per billion normal cells. But in case of asthma, it is more than 25. This is excess. Okay. So this excess amount of nitric oxide we can measure in our exhaled air, exhalation. Okay. So this test is called FeNO. That is fraction of exhaled nitric oxide. Okay. So this is established biomarker. Which one is nitric oxide? It reflects airway inflammation, and this is easy non-invasive test. Okay, this is very easy test, and it is so specific. Even milder stage of asthma, it can pick the asthma. So in milder asthma, higher FeNO concentration than normal, so it can diagnose milder patient also. But despite this, it is not being adopted as standard tool for diagnosis asthma. You must have heard spirometry, you must have all tests, but FeNO is rarely used for asthma, despite it is useful for mild asthma also. Why? In meta-analysis, they have concluded that it has high specificity but low sensitivity in diagnosis of asthma. Means it is more accurate in ruling in rather than ruling out of asthma. Means if nitric oxide is increased, you can say this is asthma. But if nitric oxide is normal, you cannot rule out asthma. That's why it is this test, despite of very useful, not adopted for diagnosis of asthma as a standard tool. But majority of societies like ERS, ATS, NICE, they all recommend FeNO test to assess type 2 inflammation accurately. All these societies. Why? Because this is the most convenient biomarker which is simple to do. Okay. It gives immediate result within 2 minutes. Okay. Non-invasive test, easy to do and safe, because there is no inhalation or exhalation. I mean, no inhalation of any drug. This is very safe. And unit is parts per billion, which is equivalent to nanoliter per liter. So unit is parts per billion, ppb. Okay. So how to interpret it? So if any individual, those who have uh, FeNO is less than 25 parts per billion ppb, then we can rule out type 2 inflammation. Means type 2 inflammation is less likely, unlikely, and ICS responsive also unlikely. If any patient, those who have more than 50, FeNO is more than 50, then type 2 inflammation is very likely. And if there is more than 50, it will respond to steroid also. Okay. The problem is in intermediate one. Between 25 to 50, there is possible type 2 inflammation, but we cannot sure. Okay. In children, this is different value. Less than 20 is low, and more than 35 is high, and 20 to 35 is intermediate. So this is cutoff value given in ATS guideline 2011. Since many years, there is research going on what is the predicted value for all individuals. Means FeNO level must be different for Indian population, must be different for Chinese population, must be different for Russian people, must be different for tall people, must be different for short people, must be like spirometry prediction. It will also different for different people. So recently, last year in 2024, ATS, ERS, they have published this article, ERS technical standard for FeNO. So they have tried to find out the predictive value for every individual. So they have published Global Lung Function Initiative reference value for exhaled nitric oxide. So they have concluded that due to heterogeneity between site and FeNO devices, it was not possible to develop a single always reference equation. Further standardization is required. Like spirometry, we don't have any reference value so far. So by the time this reference value comes, we will adopt same value 25, 50. Less than 25 is normal, more than 55 is high FeNO until new value comes. So it has many lacunae. Some patients have high FeNO, false high FeNO level, like old age, height, gender, male patient, Chinese population, atopy, rhinitis, viral infection. So any upper airway infection like rhinitis, sinusitis, bronchitis, they will have high FeNO. Low FeNO, smoking, passive smoking, active smoking, any type of smoking, obesity, and acute bronchoconstriction. So these patients will have falsely low FeNO level. So high FeNO is suggestive of type 2 inflammation. Low FeNO rules out type 2 inflammation. So what is the role in asthma? So role of FeNO in asthma to diagnose the asthma, especially T2 high asthma, eosinophilic asthma. Okay, so if it is more than 50 parts per billion, you can say this is eosinophilic type of asthma. In children, more than 35. Okay, different societies, they have given their different value, but we follow 50 for adult and 35 for children. Okay, so coming to our patient, hypothetical patient. So this lady has a symptom of 4 years, adult onset asthma. So we did FeNO test because spirometry was normal. So for diagnosis purpose, we did FeNO and it was 66 parts per billion. So what do you say? So patient have asthma, that is eosinophilic asthma, because FeNO is more than 50. So how will you treat this patient? Definitely you will start inhaled corticosteroid because patient have high FeNO, and after 2 to 6 weeks we have to see response, clinical response. Obviously we are seeing in every patient, and we can repeat FeNO after 2 to 6 weeks. So after 6 weeks this lady has FeNO reduced from 66 to 60, 10% reduction. Is it significant? So no, it is not significant. So when to say there is significant reduction in FeNO level, if there is reduction in 20% FeNO over previous value. If some patient have FeNO level of more than 50 and the reduction of 20%, then you can say it is significant after 2 to 6 weeks of initial treatment. If baseline FeNO is less than 50, then 10 ppv value is significant. But if more than 50 at baseline, the 20% should be reduced. If patient is not responding to treatment, so if there's increased 20% of value, then we can say this is significant. If baseline FeNO is less than 50, then 10, more than 10 increment in FeNO is significant. So you have to remember either increment or decrement, it should be 20% if baseline FeNO is more than 50. So we have to remember this. So another use is to see non-adherence of treatment. So non-adherence occur up to 80% of patient. That will lead to increased level of inflammation and will increase further FeNO. So FeNO is higher in non-adherent patient, means those patients who are not taking inhaler properly. So FeNO level can reduce up to 50% in 4 days. So normal, if individual taking normal prescribed dose of inhaled corticosteroid with correct time, with correct doses, with correct technique. So usually FeNO level reduces up to 50%. In this graph, you can see at baseline 88 FeNO was there, and within 4 days it came to 34. So fast it is getting reduced by ICS treatment. So if any patient, those who are having high FeNO despite treatment, we have to rule out non-adherence of treatment. Another use is to predict exacerbation. Those patients who are not taking treatment and those patients who are having high FeNO level despite treatment, they are more prone for exacerbation. In this chart, you can see if FeNO level is less than 25, then chance of exacerbation is 0.7 only. If FeNO level is more than 50, then high chance of getting exacerbation in another 1 year. Okay, so even when asthma seems to be controlled, but exacerbation is still there, so we have to predict. So high FeNO level are the strongest predictor of exacerbation versus other biomarkers. So we should use FeNO level to assess future risk of exacerbation. So this is guideline from GINA 2025. So those patients who have history of more than one exacerbation and patient has still high FeNO despite treatment, they are having higher risk of future exacerbation in this patient. Those patients who are already on treatment and high FeNO, then definitely patient will have more exacerbation risk. So if you treat patient with FeNO guidance, then asthma exacerbation will be reduced. Okay. So how to treat with FeNO guidance? After treatment, if FeNO is still high, then you have to increase corticosteroid dose after ruling out non-compliance of inhaler. If patient taking correct technique inhaler, correct doses, correct time, then FeNO should be reduced. If it's not getting reduced, then you have to increase the dose. If FeNO is reduced by 20%, then you can continue drug and you can taper down as per GINA protocol. So FeNO guided asthma management is very effective to reduce exacerbation. In this you can see in adult, this red block is FeNO guided treatment and this blue one is non-FeNO guided treatment. There's significant reduction in exacerbation even in children. So you can use FeNO for asthma exacerbation. So far we have talked about the patient who were new patient, never taken ICS. So in them, diagnosis of asthma, FeNO will help. Monitoring patient will help to see non-adherence and future exacerbation. So what will you do if having patient is on treatment already? So those patients who are having ICS lava treatment already, then cutoff value will be different for these patients. So this is taken from GINA 2025. So in this patient, if patient has never taken ICS, means ICS naive patient, 50 is the cutoff. More than 50 is asthma. If patient is having medium dose ICS, step 3 or 4, then 25 is the cutoff values. More than 25 is the significant for these patients. If patient is on high dose of ICS, means step 4 or step 5, despite taking high dose ICS, if patient is having FeNO more than 20, then we can take it as significant. Okay. So normal individual, those having no treatment, then 50 is the cutoff. Those patients who are having severe asthma on high dose of steroid, then 20 is the cutoff value. But this value varies in individual. It is more in male patient, more in afternoon, more in allergic disease, less in current smoker during bronchoconstriction. So we have to see all these factors which varies FeNO level. Okay. So this is beautiful chart you have seen in GINA 2020-25. So FeNO level useful for severe asthma also. So how it help in severe asthma? First of all, we should know what is severe asthma. So severe asthma is the uncontrolled asthma which is uncontrolled despite taking step 4, step 5 treatment when other modified factor is ruled out, like patient have correct diagnosis of asthma, patient all comorbidity has ruled out, patient taking correct technique of inhaler, correct doses, correct timing, all these factors have ruled out. Despite this, patient is having uncontrolled asthma with step 4, step 5, that is called severe asthma. Okay. For management purpose, we have to classify severe asthma, type 2 inflammation and non-type 2 inflammation. So how to say type 2 inflammation? When eosinophil count is more than 150 in blood, FeNO is more than 20 in FeNO test, sputum eosinophil is more than 2%, asthma is clinically allergen driven, and these patients oftenly having oral corticosteroid. So you have to stop oral corticosteroid at least for 1 to 2 weeks, and we have to repeat blood eosinophil and FeNO up to 3 times to get these value. Okay, so after getting these value, so we can decide which biological would be useful for that particular patient. So the role of FeNO in biologicals, if FeNO is more than 25, then we can start dupilumab. So FeNO help to start biologicals in case of dupilumab. Other biologicals, FeNO is not a criteria. But if FeNO level is high, then these patients will respond better if FeNO level more than 20 in case of omalizumab, FeNO is high in case of dupilumab, and FeNO is high in case of tezepelumab. So these patients will respond better with biologicals. So FeNO help. So high FeNO predict better asthma response to add-on treatment with dupilumab, omalizumab, tezepelumab than lower FeNO. The efficiency of anti-IL-5 like mepolizumab, restuzumab, and belazumab is independent of FeNO level. So FeNO level help to initiate dupilumab and tell about better asthma response in these three biologicals. So this is help in severe asthma. What is the role of FeNO in pregnancy? If you treat asthma in pregnancy with the FeNO guidance, then there would be 50% less chance of exacerbation during pregnancy if you treat with FeNO guidance. Okay, so not only help pregnant lady but also help in his baby, in her baby. So there will be 90% reduction in recurrent bronchiolitis if you treat patient with under FeNO guidance. Role in COPD. So in COPD, if there is overlap, means asthma and COPD. In COPD, if there is high FeNO, then these patients would respond with the corticosteroid in a better manner. Okay. So this is role in COPD. Nasal nitric oxide is not being done, not in practical purpose. So we'll not discuss. So now coming to procedure, how to do FeNO test. So we will see live demonstration also. So before doing FeNO, we have to see whether any contraindication is there or not, like active or recent respiratory infection, children less than 5 years, severe airflow obstruction or advanced COPD, or any patient those who are using active ICS at the time of doing FeNO. So we should not use FeNO at that time. So before procedure, at least 1 hour before, we have to ask patient not to take any food which contain nitrates like green leafy food, consuming any alcohol or caffeine, and using any steroid or rescue inhaler just prior to FeNO test. So this is FeNO machine looks like, this is handle and this is mouthpiece. This is machine and this is display, and in between of display there will be reading of FeNO value. So step, patient has to take deep inspiration, full inspiration up to TLC, total lung capacity. Then patient has to exhale with constant expiratory flow rate. This is very important step. Patient has to exhale at least 50 ml per second flow rate. Why this flow rate is needed? Because we should know that our nasal cavity has lot of eosinophilic inflammation that produces nitric oxide constantly. So we don't want our nasal air mixed with exhaled air. So what have we have to do? We have to close our posterior nasal chamber so that nasal air should not mix up with exhaled air. So how to do that? We have to exhale forcefully, till forcefully, at least 50 ml per second flow rate. So if you exhale with this flow, the posterior nasal cavity will close and the air from nasal cavity will not mix up with exhaled air. That's why we have to blow at least 50 ml per second. We have to expire up to 4 to second, and there should be 3-second plateau. Then this result will come. So the machine will show the value, how much FeNO. We will see live procedure also. So to summarize, the role of FeNO in asthma to diagnosis, because it shows type 2 inflammation, especially helpful when spirometry is unconclusive. to identify type 2 inflammation or eosinophilic type of asthma. Predicting response to corticosteroid. If FeNO is more than 50, then patient will be benefited from inhaled corticosteroid. If lower than 25, patient will not respond. Monitoring asthma control, especially non-adherent to ICS. So if FeNO is getting higher and higher, it means either patient is not taking inhaler or underlying inflammation is getting increased. If FeNO is decreasing after treatment, it shows good response. And last, guiding biological therapy. As I told you, if FeNO level is high, we can consider dupilumab, or FeNO is predictor for response to many biologicals like omalizumab, dupilumab, and tejupilumab. So high FeNO predicts better response. So now come and let's see live demonstration of FeNO test. So we have to take new mouthpiece for every patient to take clockwise. Now you see display. In display you can see this 5 dots. This is for inhalation. Once you inhale, all 5 dots become yellow for full inspiration. Then you will exhale, and this marker should be on green line to maintain flow of 50 ml per second. Now start. So blow, yeah, inhalation completed. 5 dots yellow. Now blow
बहुत बढ़िया बहुत बढ़िया
for 3 seconds should be steady.
बस
Very good. Now proceed complete. The reading will come after 1 minute. So we'll wait for 1 minute. Then now reading is 14. Very good. So friends, I hope you like this video, and you must have learned many things from this video. If you learned many things from this video, please like it, share with your friends, and if you are not subscribed to this channel, please subscribe it. We will meet with another video. Thank you very much.